So this is take number 2, and I'm going to try to keep it together in this one. You may hear my little puppy, Luke Skywalker, in the back. He likes to bark at noises outside. Yeah, so I just wanted to talk about, what I'm going through, because I don't want people to feel the same way that I feel. Or I don't want people to feel alone like I feel going through this, because I know I'm not the only one. Yeah, so to give a little bit of backstory, I'm in the Navy, and I'm stationed in Southern California, and last year, in 2016, I was deployed to Japan, and in the middle of that deployment, I started experiencing really bad eye pain in my left eye, and over the course of a month, it resulted in complete blindness, and the neurologist over there didn't really know what was going on with me, and I went blind in my right eye also, and I kind of went untreated for 2 months, and it took me a long time to get back to the States to get proper medical treatment. But what I had was bilateral optic neuritis, and what that is your optic nerves are behind your eye, and that's what receives the picture from your eyeballs and sends it to your brain to process, and kind of let it know what you're actually seeing, and that's the best that I could try to explain it on medication. And they didn't really have a diagnosis for me at the time, and so I got sent back to the States, and as soon as I got back to the States, the next day I checked in with my primary care physician, and I was admitted to the hospital that same day. I was given an MRI, a spinal tap, and they thought that they were treating me for neuromyelitis optica, which is where your immune system creates antibodies that attack your optic nerves and your spinal cord. And so they were treating me with 5 days of IV steroids, and I didn't respond to that, and that was supposed to help resolve my vision issues, and that didn't help. And so they started me on plasmapheresis, which is where they pump out my blood and filter it out, take out my plasma, and filter it out, take it out, and replace it with fake plasma to take all the antibodies out. And they did that 7 times over the course of 2 weeks. And that's what helped my vision get to about 20/70. And I was still in a lot of pain, but I was feeling a lot better when I was in the hospital and when I got discharged. When I got out of the hospital, I was feeling pretty good, and it was September 2016 when I got out. And I was following up with my neurologist and my neuro-ophthalmologist, and my follow-up treatment was going to be rituximab, and I got that in November and December, but during this time, I was having really bad symptoms, my whole left side of my face and my left eye it's numb, and I have a constant headache there, and I go through cycles to where I have these vicious migraines, like chronic migraines, and it's just miserable, and I have chronic fatigue, and my body just gets tired differently than yours normally would. And I have really bad vertigo at times, and I'm falling and I'm being dizzy, and it's pretty ridiculous. And sometimes I'll fall asleep in the middle of a sentence, or I'll fall asleep and forget what I did that morning, confused, and it's really frustrating because I'm on medication to help these symptoms, but the medication that I'm on also have really bad side effects, so I have to deal with the side effects of my medication, and I also have to deal with the symptoms, and the medications that I'm on only help reduce the pain a little bit to make it tolerable. I oftentimes don't have the energy to do anything. If I get hot, like my vision is around 20/80 today, and if I get hot, my vision goes to 2200, which is legally blind, so I can't drive. It's not safe for me to be walking on the street or being in public. It's not really safe for me to be out there by myself, which is really frustrating because I used to be a really active person, and I can't exercise because I'm so weak. Anyways, so my doctors have been struggling with the diagnosis of neuromyelitis optica, which I already explained to you, because my bilateral optic neuritis lasted for so long, and I guess it's atypical for that to happen, which is not normal. So I was in limbo basically because I'm in a limited duty status in the military, so I'm at a command where I don't work. All I do is take care of my medical appointments and focus on being better, and I don't know whether or not I'm going to be medically retired or medically separated or whatever the case may be, and my primary care physician doesn't really know what to do with me, my command doesn't really know what to do with me, and so I finally got referrals to Balboa Medical Center down in San Diego, which is a very large naval hospital, which is like 3.5 hours away from me. And I got to see a really good ophthalmologist and neurologist, and they're going to help me find answers and help me find out whether or not I do have neuromyelitis optica, or if I have anti-MOG, or if I have Lyme disease, or the other things that cause optic neuritis. But today was a rough day because my left eye has gotten really bad. Like, he took pictures of my optic nerve, and you can see where the demyelination is. It's like a little healthy donut, and it's black, halfway black. So it's all tissue that can't come back. And if you don't know me, I'm a really active and happy person. And I love my job. And I love the Navy. I love the military, and I love serving my country. And it's miserable having all of that taken away. I always joke around and tell everyone that I would gouge out both my eyes and be blind forever just to go back to work and be normal again. And I would. But the moral of the story is like, you just gotta keep going. No matter how miserable it is. Because it is pretty miserable. Being away, I'm pretty far away from family. You're pretty alienated from your friends when you get sick. And so you're kind of lonely. And I'm really lucky. But you feel isolated and you feel like nobody understands, but there are people out there who have optic neuritis, and there are people out there who have neuromyelitis optica, or have multiple sclerosis, or have all these illnesses that cause optic neuritis, and losing your vision doesn't change who you are. You can continue on being whoever you want to be. Like, I'm starting college. Actually, I already started college, which I'm really excited about. And I'm trying to be proactive and positive and doing some volunteer work. And hopefully I'll keep checking in with everybody. This video is really all over the place, but I hope this can get to people who it can help. And if anybody needs somebody to talk to, I'll leave my Facebook or email in the whatever's in the bottom. I'm on Topamax, which we call Stupid Max, because it makes you stupid. Oh, goodbye.